indoor choir practice, a lot more than 6 feet. Outdoors with the wind blowing, perhaps 5 feet will get you by. With that, why don't we go, Don, to the first question?
Yes, sir. This is probably one for Dr. Shah. Susie from Woodland Hills, you are live.
Thank you. Thank you for taking my call. Doctor, I wanted to ask about 2 questions. One is, I want to know the most efficient test out there. There seems to be tests that are not efficient these days. And number 2, if I get a test and it's negative, and then a couple days later or a day later, I'm going out to the grocery stores, I'm going to run my errands, and I'm in front of all these people, do I have to keep getting tests every couple of days?
Yeah, it depends on what you do. If you're a healthcare worker and you're going to be caring for people, there are different policies of how frequently you need testing. I was just tested on Friday. There's 2 main kinds of tests you need to hear about. One is something called a PCR test. That's that nasal swab which they stick in your nose. And the other main type of test are blood tests called serologic tests. And those measure something called antibodies in your blood. The first test, the PCR test, see if there's an actual virus itself in your body. And that is, are you actually infectious now? The antibody test, the blood test, however, tells you if you've been exposed in the past and has your body made an immune response to it. It's checking for that. And some people think that it even confers a little bit of protection. We're not 100% sure how long that protection lasts from COVID, but those are the serologic tests. So most people are getting the PCR tests, which are in widespread use for active infection to see if you are also infectious to other people. Then about that turns positive about a week into your symptoms of having COVID. The antibody or blood test turns positive about a week after that. So depending on when you think you've been exposed, let's say you took a cross-country flight and you were in the middle seat of 2 people coughing, then you'd probably get a PCR test a few days later. And a week after that, if you have symptoms, a week after that you get the antibody test turns positive. Now, all of these tests are not perfect. Let's say they don't stick that tube deep into your nose enough to get a good sample. It could say, oh, you don't have the virus, when it actually was just not a good enough sample. That happens all the time. Same thing with the blood test. There are things that are falsely negative or falsely positive. And the best way I would suggest is it's too complicated to understand the quality of all these tests. But if you go to a reputable medical center, UCLA, Kaiser, or other places, as opposed to buying a test on the internet, you're more likely to get a higher quality test. And more importantly, they can tell you what their rate of false negatives and false positives are versus those thousands of tests. Actually, it's hundreds of tests now available on the internet. In fact, my brother's selling some of them. I don't know where he got them. So you want to stay away from those tests on the internet. Even though some of them are pretty good, there's no way for you, unless you know the sensitivity and the specificity and the positive predictive value of the test, to really figuring it out on your own.
What about a spit test?
I'm sorry, what about the which test?
Spit test. I heard that was there. Spit test? Like you spit in a
spit test. Yeah, that's a new one. That's one of the new ones. So that is actually not bad. It's actually a very good test, but there are several flavors of spit tests available, so make sure you get the right one. I think today the best and most widely used tests are those with the nasal swabs that are uncomfortable. Those have the most data supporting that they're accurate and highly tested. The spit tests are pretty new. We're not 100% sure of how they work in everyone yet. There's even a new, I simplified, there's those tests of the virus. There's tests of the blood that look at your infectious response to the virus if you have antibodies. And there's now new tests called antigen tests, or they look at the actual protein of the virus in different ways. And so all of these are evolving. Stick to a reputable medical center, and they'll probably steer you right.
And Susie, you're right to point out, if you get tested today and it comes out negative, and it's an accurate negative, that means you do not have the disease today, but you might catch it tomorrow. And in fact, if I understand Dr. Shah's answer correct, not having the disease today probably means you weren't infected less than 48. You could have been infected in the last 48 hours, and it wouldn't even show.
That's right.
So if you're tested today, it means that you didn't get the disease more than 2 days ago. You don't have the disease now, but it says nothing about what's going to go on in your future. And that is why, at the policy level, people are looking at the idea that we're going to have to test huge numbers of people every couple of weeks. And the goal on a policy level is not to be perfect for everyone, but to keep this disease under control, to be able to do the contact tracing. There's nothing that's going to be perfect until we get herd immunity, and that's either going to come from a vaccine or from, God forbid, an uncontrolled spread of this disease through our community. And doctor, it's my understanding that flu has a mortality rate, influenza has a mortality rate of around 0.1%, and this disease has a mortality rate of at least 10 times that. Do I have that about right?
Yeah, it's order of magnitude, right? We're not sure. The study came out yesterday in LA County showing that 44% of the number of people who've been exposed to COVID is much, much higher than we thought. About 44 times as many people who've tested positive. So we know there are huge numbers of people who are carrying the disease without having symptoms. And so while the mortality rate is high, what we definitely know is that the mortality rate is highest in those people who are older or have multiple chronic conditions. So that's why Italy saw so many people die. They had so many people over the age of 90. And, that was half the people probably died in some of the towns over the age of 90.
And half the people who have died in LA County, I believe, are those who are living in things like senior homes, who are both all together, which is a problem, and, of course, they're seniors. We're now going to do a survey question so that even those who may not be able to make a comment or ask a question will be able to express their opinion, because we're going to have a number of these questions. And the first one is, do you think California is reopening too soon, or about right, or not soon enough? So if you think that California is opening too soon, press 1. If you think Gavin and the state government have it about right, press 2. If you think we should have opened up long ago or weeks ago and that we're not opening up soon enough, press 3. And if you're unsure, press 4. We'll tabulate those answers for you soon. And in the meantime, Don, let's go on to the next question.
All right, Naomi, somewhere in the valley. Tell us where you're from, and I think you have questions for both the Congressman and Dr. Shah. Naomi.
Yes, hi. Hi, I'm Naomi. I'm from Woodland Hills, and I have two separate questions. The first
I'll let you ask two questions, and everybody else in the queue should try to limit themselves to one, so we can deal with as many questions as possible. Go ahead, Naomi.
I'm sorry. I'll just ask them, and then you guys can do whatever you want. So the first one is, I think that tracing is really important, and I'd like to know where we can set ourselves up to get tracing training so that we're ready to go when that needs to happen, which should be yesterday. And then the second question is that we applied for a PPP and an EIDL, and we keep getting messages from Wells Fargo, we're resubmitting your app, We did this when it first started. We've never heard anything about either one of them, and we don't even know where to go to follow up on the EIDL. So that's those are my two questions.
As to the second one, I would say call my office tomorrow, 818-501-9200. I do talk to senior executives at Wells Fargo to try to make sure that San Fernando Valley businesses are treated well. And at the same time, I've worked for over 23 years with the credit union movement, and now and then we can get a credit union to take on somebody who has not been their customer in the past. And then finally, there's a company called Cabbage with a K that is a computer organized, an online financial institution, and they are accepting applications and customers. You can apply through more than one financial institution. The SBA has it put together so that once they say yes once, they're going to say no to all your other applications. And so, obviously, if you have a Wells Fargo connection, if that's your bank, that's where you'd want to go first. But give us a call, 818-501-9200, and we'll do our best.
Thank you.
Thank you. And as for the course, there's a free course online that Johns Hopkins is promoting, and you can just Google COVID-19 contact tracing course Johns Hopkins. You'll find it. It's listed on Coursera. It starts today. I think about 160,000 people have already enrolled, and at the end you get a certificate. So that hopefully that certificate will work across California as they start to hire different tracers.
Thank you. Let's go on to one more question, and then we'll do another survey question.
Okay, Brian from North Hollywood, go ahead.
Hi, Congressman. Thank you so much
Hello.
for doing that. So when the first three phases of the economic stimulus were being debated, progressives argued that Republicans wouldn't have an appetite for further stimulus after the businesses were protected. Leadership told us that the real fight for progressive legislation would occur in phase 4. But now it's clear that Republicans aren't going to be willing to accept any Democratic demands with regards to automatic stabilizers or vote by mail. So my question is, what measures are you going to insist on in any future legislation to make sure that Republicans can't sabotage the economy to hurt a Democratic president in the future?
Well, my focus is on getting through this year. I haven't yet game planned the idea that somehow we would have a Democratic president in February of next year, and a Republican Senate would try to sabotage the economy at that point. When it comes to insisting, we really have got to rely on our leader, Nancy Pelosi, to do the negotiating. It's very easy to say, well, the Republicans control the White House, the Republicans control the Senate, but we control the House, so we should get what we think are good policies. I think that the bill we voted for in March was a good bill, but it did come up short in the sense of making sure that every American can vote by mail. It also came up short in the area of automatic triggers. And so it will be up to Congress, if we're going to spend more money, to spend it at the time or through additional legislation. It is, for a number of technical reasons, very difficult to pass a statute that has automatic triggers in it. And there are some advantages and disadvantages. I'd like to think that the best decisions for the fall will be made in the fall. It's a little harder to decide in the spring what you should do just on a numerical basis in the fall. The thing that makes it hard to pass legislation with triggers is the scoring system. That is to say, if you put in those triggers, then the Congressional Budget Office will say, you've got a $12 trillion bill because, well, it's going to trigger, and then it's going to trigger, and then it's going to trigger, and then it's going to trigger. And it is very hard to pass a $12 trillion bill. The HEROES Act that we passed puts forward our position. The thing that is not in the bill that the Republicans want very badly is liability protection from businesses. And I can't imagine that they're going to get that if we don't get an awful lot of what is in the HEROES Act particularly 8 to stay in local governments, and particularly some system so that people can be safe and secure when they vote. But it is very easy on the outside of Congress to say, here are the easy part is to say, here are the 10 things I want. It's easy on the outside of Congress to say, and if I don't get all 10 things, I'm voting against the bill. That's a little harder to actually do. I'm a member of the Progressive Caucus. The co-chairs of the Progressive Caucus split on the HEROES Act. Mark thought it was sufficient and voted for it, and Jayapal went the other way. And that isn't even a bill negotiated with the Republicans. That was one negotiated among Democrats, but also reflective of what would appeal to independents in the country. I think we have some results coming up. Those who think we're opening too soon are 44%, about right, 35%, not soon enough, 13%, and unsure, 8%. Doctor, I have a pretty short question for you from someone who RSVP'd for this, Teresa Comito of Woodland Hills, who asks, why are we not opening all of our businesses with guidelines? And I think she meant now.
Yeah, it's a great question. I wish we could do that, and the problem is we just don't know. The science isn't there. We could make things up. We could say that you need to have no more than X customers a day in a hair salon versus Y customers in a restaurant that has open-air seating, but that would be made up because we don't know. What we know is very basic. We know that distancing helps. We know that masks and anything to do to limit the number of people in a given location slows the spread. And that's why the guidance is different if you go from one county to the next, from one state to the next. My personal guidance to people is think about what your risk is and what would life look like if you had coronavirus. If you're 15 years old or 20 years old, it's a very different thing to have a 2-week bad flu for most people who get COVID and then recover. It's very different if you're 55 years old, 60 years old, or older, when you think you may end up in the hospital, on a ventilator, or not even make it. So personal risk is what you should decide your circumstances on. If you're older, stick to the golf course where you have lots of distance between people and you can wear a mask the few times you have to go close to someone else. If you're younger, you can do your part to help slow the spread by avoiding large gatherings, but you have to also make your own personal estimate of what you think you can do relative to what you need to do for work and for other things.
Doctor, I might slightly disagree with you on that in one respect, and that is, yes, you can be 15 or 20 or 25 years old and decide what's good for you. But there for a while, and I know this changes as we change how we live, the average person who got COVID spread it to 2 or 2.2 other people. And that person may not be 15 or 20 or 25 years. So when you make a decision that it's not only about your health, it's the health of those in your family who are close to you, or just somebody who could be at Ralph's in the line in front of you. If you get the disease and it doesn't have much of an effect on you, that's fine, but you could be in Ralph's the day before your symptoms show, and my mother could be in the line in front of you. So please keep that in mind. Now,
that's absolutely 100% true. I appreciate your clarifying that. Many multi-generational families, other places that are going to be affected, all are based on what you decide to do, and it doesn't only affect you, it affects your neighbors, it affects your community, it affects the ability of the healthcare system to respond and have capacity for others if you're already taking up a bed.
The next survey question requires me to explain something that Dr. Shah explained to me just a few hours ago, and that is there is new technology, it's not very expensive, where you get a thermometer that works with Bluetooth from your phone, and then automatically reports to public health officials what your temperature is. And if public health officials can get every day hundreds of thousands of readings, where are people with normal temperatures? Where are there a disturbing number of people with a 100-degree temperature? Where are there people with a 102-degree temperature? They can determine where is a place to be concerned about COVID or influenza, and what is just the background number of colds that you expect. So the survey question here is, if the government gave you a free Bluetooth thermometer, would you take your temperature every day and have your phone report your temperature every day, which means the government knows whether you're hot or cold every day? If you'd be willing to do this, if you want the free thermometer and you want to take your temperature and report it every day, press 1. If this is something you just as soon not do, press 2. And if you're unsure, press 3. So this is the question about the Bluetooth thermometer. And Don, let's go on to the next participant.
Right. Stephanie from Tarzana, you're on now.
Good evening, Congressman. Good evening, Doctor. Thank you for taking my call. My question is, it was brought up at the last town hall meeting about the mortgage companies that were putting things on forbearance instead of putting the payments on the back end. And I have some friends in Montreal and Vancouver and in Canada, and they're doing that in Canada. Why aren't we? Is anything on the table, for us for that? Is that in the future? Is that something that they would consider?